I wanted to talk about what is Ayurvedic cranial therapy. So right now I'm sitting in my backyard in Costa Rica, and as you can see, I have a very nice backyard. The ocean is a little bit loud today, so we'll see how this video works out. So, in talking about Ayurvedic cranial therapy, let me give you a little bit about the history of how it came to be. When I was in my early 20s, I was very interested in the cranium, but they don't teach cranial manipulation in chiropractic school. And so I just started to work on heads and began to develop my own technique. When I got into the clinic and started my clinic internship, I began applying some of these techniques, and I got blown away by some of the results that I was getting. Literally in my first month of practice, I was curing people of chronic, recurrent, and very severe headache syndromes, and the patients seemed to really like the technique a lot. So when I graduated from chiropractic school, the college hired me as a technique teacher, and I began working on some of my students. And my students thought that the work felt so good that they convinced me to teach them. And so then I had to flesh out some of the principles and concepts underlying the technique, and I began to put together small groups and doing trainings. Well, that course became extremely popular, and before I knew it, I was attracting healing practitioners in many different fields and started to teach hundreds of people this technique. Now, when I got into my 40s, I began to study Ayurvedic medicine, and I started learning a lot of things that I thought integrated really well with the cranial techniques that I was doing. And so I also fell in love with the Ayurvedic terminology, which is just a wonderful language for teaching healing. And so what evolved all of that is my current course, which I'm calling Ayurvedic Cranial Therapy. So in talking about the technique, the first thing is that it's a little different than other cranial techniques that are out there. It's not sourced from other cranial techniques, and also the principles and concepts are a little bit different. The foundational principle of this work is just simply that when tensions and stresses build up in the cranial structure, then that transmits those stresses to some of the functional elements like the nervous system and all the different cranial structures, and that when you can get in there with your hands and begin to work out those tension patterns, that takes pressure off of the nervous system, removes blocks, restores the normal intracranial fluid flow, and just takes tension out of the system, and then a lot of the functional elements begin to work a lot better. So to describe the technique, it's a little bit of a lot of different types of interventions. Some of the work is light touch, some of the work is deep pressure, and pretty much everything in between. Some of it is drawn from yoga and Ayurvedic medicine, and what's unique about now the present manifestation of this work is it's not just a technique for working on the bones or even working on the bones and muscles, but we're actually working on some of the intracranial structures like the eyes, the ears, doing direct manipulation on those things, the sinuses, but also applying a whole series of a whole palette of auxiliary and complementary techniques for restoring the optimal function of all the cranial structures. So we use things like medicinal oils and therapeutic herbs and aromas and techniques that come from Ayurvedic medicine in order to have a complete system of holistic treatment for the head and face area. Now, in this work I do teach a sequence, kind of like a paint by numbers sequence. This sequence, when it's done in the way that I teach it, takes about 25 minutes or so to complete. But to be honest with you, it's not so much that I want to teach you to use the exact same sequence that I use. I more teach you the tools so that you can use any of these techniques in any way that it fits in with the other work that you do. You can sequence it yourself or just do parts of it. Also, when you apply many of the auxiliary techniques, like when we do things like specialized treatments for the eyes, specialized treatments for the ears, and some of the oilation treatments, then you can create a much longer session, like a 55-minute or 60-minute session as well. So I give you a lot of tools, and then you can put it together in any way that you want. Now, the application of these tools, there are several different categories of applications. One of them is just for clinical syndromes and different problems that are affecting the head and face area. Headaches are super big. These techniques have an incredibly positive response to people with different types of headache syndromes. Getting rid of a headache is fairly easy, I think, for most hands-on healing professionals, but working with people that have difficult recurrent headache syndromes is another story. And so I've really helped a lot of people with headache syndromes get off their meds and be able to attain a much better life. Other kinds of clinical syndromes are jaw problems like TMJ or just simple jaw tension syndromes. Respond very well. This is, I think, the best type of work for those kind of problems. Sinus problems, also nerve problems affecting the head and the face, like tics or nerve paralysis problems like Bell's palsy. I've had actually extraordinary results on treating people with Bell's palsy. Very often, being able to cure it in literally days, especially if I get to treat it within days of onset. It's also great techniques for healing cranial trauma, like concussions. I've worked on people who've fallen off their mountain bike and onto their face and had extreme head injuries. I've worked with people who've gone through windshields and put their cranium back together again. So these are applications to working on the physical problems that manifest in the cranial areas. The second application of this work is for psychological problems. When the cranial system is under stress and tension, then that's going to put tension on the nerves. And when there's tension on the nerves, then people get nervous, or it can create many types of manifestations like nervousness, anxiety, difficulty in concentrating, insomnia, attention deficit. All of these problems are very often a result of strain and tension on the cranial nerves. And when you get in there and relieve those stresses and tensions on the structure, then you get functional changes. Then people feel better, they're more relaxed, and some of those symptoms will get dramatically improved. Third application would be just as a bliss therapy, because this work feels so good and is so relaxing. I've heard it over and over again from many people that I've worked on that they feel the most relaxed than they ever have after one of these sessions. And so when you start to add in all the other beautiful flavors of this work, like the right aromas and nervine sedative or nervine tonic herbs and teas and therapeutic oils, then this is extremely blissful work. It feels great, and you don't need to have clinical problems like psychological issues or head trauma or symptoms to be able to enjoy this work. So that's pretty much all I wanted to talk about. that should explain a little bit about what this work is all about. And if you're interested, then join me in one of my trainings. I do trainings in small groups, so I can give the individual attention that's necessary in order to learn these techniques properly and do them well. And all the information about my trainings is available on the website. Thanks for listening.